All right, good evening, everyone. We're going to start the meeting. It is 5:31, and I call this meeting to order.
The meeting's being recorded.
Oh, that's right. Our meeting is being recorded. If everyone could please rise for the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. It says public hearing on our thing. That's probably why.
Oh, yeah,
Maybe
we
it's-
missed that.
Yeah, I think that's a typo. So this is just a public Board of Health regular meeting. It's not a public hearing. I think that's just a typo on our agenda. All right, so I'll turn it over to you, Pat.
Okay, so the first item on the agenda under old business is the issue of an appointment of an animal inspector. There's been an uptick of dog bites. In the month of June, we had one again this past weekend. The Board of Health is out of compliance with the requirement to have an animal inspector. I'd ask that the board send a letter to the selectmen asking them to appoint somebody as quickly as possible. The second item on the agenda was the Fish Road public participation. I'm going to ask you to table that. We're waiting for some information from town council on that.
Okay, yep. Do you want us to vote on that? All right, so I'll entertain a motion to table number 2.
I second the motion.
So you have to do it.
No.
I make a motion.
I make a motion
To,
to table this Fish Road till we get more information from the town council.
I have a motion. Do I have a second?
Second.
What's going on with Fish Road?
We're going to table that
Why?
because we don't have enough information. That's why.
Well, I'll just speak up.
Huh?
If we could all just speak up, we wouldn't
Yeah.
have to repeat it. You need a second to the motion.
Second.
All in favor?
All in favor? All right, it passes. We'll have some,
No.
we'll have some time at the end of the agenda to do public comments.
When you're speaking just now,
Yeah?
it's very clear, but you can't hear Mr. Hannon.
Okay. Want to turn one, maybe we could turn this one?
No, I'll just move this right over here. I can hear myself talking in the
Is that
speaker,
better? Yeah, okay.
so- Okay.
It's hard to tell with these little guys on the table.
Actually, these are more sensitive than...
Oh, all right, go ahead.
The next item on the agenda for discussion is the bike rodeo.
Okay, so the bike rodeo was a huge success this year. Last year, we had a goal of 50 children and families, and this year we surpassed that with 53. I know it was only by 3, but it was really great. It was a great turnout. The weather was perfect. It was just amazing. We had families from Dudley, Oxford, Charlton, Webster, Millbury, Townsend, and we also had a family from New Hampshire. Children's Hospital came, so we'd like to thank them for coming out with their helmets. We'd like to reach out to them again next year. Amanda, if we could send them a letter thanking them and then just kind of going over our agenda a little bit about the time that they should be there so they're not late like they were this year. That would be helpful. Some ideas for next year. It's always great to brainstorm. I feel like every year we do this, like I think of something again for the next year. The schools have been really helpful, the library, Boys and Girls Club, but I was thinking maybe this year instead of them posting it on their social media, maybe this time we'll leave the flyers there because there are a lot of activities that go on there. There's a lot of groups during the week that show up, so maybe the families, if they actually had the flyer in hand, they would remember. Going to the Strawberry Festival seems to be pretty productive for us, but we got some ideas moving for next year. We also love ideas from the community if anyone has anything too, but so far, I was happy. I thought it was great. This was your first year, so I was happy to have you participate, but this was great.
We did have some donations. Ben's Rubbish from Douglas donated the portable toilets. D&D Rubbish from town put out some rubbish containers and took the trash away for free from that event. So thank you to them. MapFree also was involved in the helmets with the Children's Hospital. So
And
fire department brought their
oh
smoke.
my God, what's the name of
their smoke trailers.
Gentex
And
came.
Gentex came and gave
yep.
away sunglasses to the kids
Yep.
and lots of nifty little toys and things. The fire department did a really good job with their smoke trailer.
Yep.
I saw Dudley go through the smoke trailer. Dudley really enjoyed it.
That's great.
The kids enjoyed having their pictures taken with Dudley at the bike rodeo. I actually enjoyed it myself.
It was your first year also.
It was.
Yeah.
It was fun seeing the little kids, the smiles on their faces, the fun they were having.
Yep.
Jimmy's Pizza donated pizzas. Big Al's donated pizzas. It was just a very good event.
Yeah, we
Yeah.
had some kids from last year that came.
The Webster Chamber of Commerce donated the bottled water that we used for the event, so thank you to them too. And looking
And
forward to
Sergeant
next year.
Lepowski.
Yep,
And
the
Sergeant,
police sergeant that
Yep, Magus,
did
yep.
all the training for the kids. And some other volunteers showed up to help the kids go through the course as well, some residents. It was good.
Yeah. Bigger and better next year.
Yeah.
All right. New
On to
business.
new business?
Yep.
So you would ask to have a discussion about the Board of Health having a health fair.
Yeah, so I think I'll lump number 2 into that as well, the flu clinic.
For the flu clinic? All right, yeah.
So, in the past, actually, I think we've only had one. We did it with Charlton for the schools, where we did flu vaccines. And this year, now that we have you, we have an agent that can help us. I'd love to try to do a health fair in the fall where we could tie in flu vaccines and do screenings and preventative measures like blood pressure screenings, maybe some podiatry screenings, just some, I have a friend who's a nail tech, and she's certified as a medical tech in podiatry care. So maybe she could come and just do some screening, not to so much do a pedicure or anything, but we could do lung sounds. We could do height and weight. I also was thinking perhaps we could get the schools involved, because I know the elementary level, they have to do height and weights and BMIs, so maybe we could do something like that. I'm not sure if that's allowed, so that would be a conversation to have, and we could reach out to Quinsigamond or Bay Path, and what's the college downtown? You went there, right? Mass
College.
Yeah, they have students, so I know in the past they've had students who will come to these clinics, and they'll get their hours, they'll get their experience. So something that we can kind of put together, reach out to Joshua Place and see if we could get our residents vaccinated. If they want a flu shot, they can. If they don't and just want to participate, just come see. This is all just here, first idea, first time bringing this up, so I'm happy to take ideas from anyone, if anyone has ideas. So that's kind of what my thought process is. I don't know if you guys have any ideas as well.
Are you thinking this would be a fall event?
Yeah, like October,
In the
November.
building, outside the building?
I guess depends, and we can start, if weather, I don't think the weather will be that bad in October, but we could have it downstairs in the senior center downstairs. And then we also have the police have been kind enough in the past to let us use the training room downstairs, and that's where we've done our COVID vaccines.
Okay.
So we could do, vaccines in that room, and maybe we could do blood pressure over here, or we could do something over here. And maybe as this turns out to be a little bit bigger than I'm thinking, we could bring it outside and have some tables or something.
And do we know yet if the board's able to order vaccines? Is that going to be through the color program, or?
That I don't know. I know in the
Okay.
past my hands were tied. I wasn't able to get them. They only allow you to get so many free if you're in a certain age group, so I don't really know. So we have to do a little bit of homework. That's why I wanted to start talking about it now in July, and not be like, September, and then have a month and then find out, you didn't have enough time. So if we start brainstorming down, we have, August, September, and hopefully can pull it together for October.
We could possibly promote it too, maybe at the Apple.
Yeah, the Apple Festival?
Yeah.
Yep.
Could I ask, maybe we would do blood glucose? Can we do that?
I'm not sure. You have to
Can
speak up.
everybody speak up just so-
I'm
I
not
don't
sure.
know which-
Either
I'm
one.
not sure if
Or you
we're
can do
allowed
both
to
and
do
have
that,
several.
so I guess these are all questions that we need to find out, like how invasive are we allowed to be? We could give a vaccine, but I'm not sure about that, so we can find that out.
Okay.
But then the only problem is we don't have the glucometers, so how would we get them? So these are all questions we have to find out.
Okay, it's just that the pharmacy students would have them if we
Yeah,
had them come
yeah.
down on a volunteer basis.
I guess that might be something we can put down on our planning, is if we could reach out to those students, is there a professor that would have the answers to all these things?
Okay.
That might be the first thing that we start with, is reaching out to those schools. I don't know if you have a contact. All right.
Number 3?
Oh, did you have something?
Also, I mentioned the blood drive. We wanted to look into that. If down the road we just do a blood drive too at some point. We can look and see the possibility
Yeah,
of
you
that.
speak up a little bit.
I was mentioning that I wanted to look into doing a blood drive, being as there's a blood shortage right now. If we're somehow allowed to help out to conduct one.
There was a blood drive earlier in the year that seemed pretty successful. I happened to be, I think it was on a Saturday. There was quite a few cars in the parking lot, so might be worth doing.
Okay. All right, number 3.
So we've had some applications for some wells in areas that have been affected by PFAS. And I sent an email to town council, and I'm waiting for an answer. So I would ask you to table number 3 as well.
Okay, so we have to take a vote on that. I'll entertain a motion to, for number 3,
To table.
table it. Which one of you ladies?
My turn?
Sure.
You gotta walk me through, this is my first time.
So I make a motion to table.
Table item number 3.
Item number 3.
So, am I second?
No, you're gonna do it, and then Heather will second it.
Oh, so I'm making a motion
Uh-huh.
to table number 3?
Sure. I have a motion, do I have a second?
I second the motion.
All in favor?
Aye.
Okay.
So I'm going to hand this down. Just take 2 and pass it down.
At least your first time wasn't reading the big print.
Yeah. So number 4, DEP sent out a template for new well regulations that they're recommending that local boards of health adopt. I'd like you folks to take this home and check it out, see if it's something you want to entertain. I would adapt the model regulation to Dudley, just fill in all the blanks. And we could bring it up at our next meeting and go through a discussion on that, but it's a little bit of reading. I only gave you the first 2 pages as to why they want to do it. I'm not going to bother you with the other 12 pages of regulation that really don't fit the town yet,
Okay.
all right? So that's that. And then number 5 is I've been alerted to the fact that we're not in compliance with a rabies requirement under 105 CMR 335.000, treatment of persons exposed to rabies. So I was contacted and told that we need to, if a person does come down with rabies that does not have insurance, and I did some research, rabies is extremely rare. There actually hasn't been a case in Massachusetts since 2011, but we're still required to meet this requirement. And if someone contracts rabies that does not have insurance, the Board of Health has to have funding to pay for that person. So I'm going to suggest that for October's fall town meeting, that we transfer $1,000 out of the tobacco account into a revolving account for rabies. And if you folks want to make a motion to do that, we could do that, or you can
Okay.
think about it, and we could do it at the August meeting, but I'd ask you to do it tonight. I mean, it's a pretty basic thing. And I don't know how much it would be, but I think $1,000 would cover it. And we have over $10,000 in that account, right, Amanda?
So maybe by our next month, our next meeting next month, we could just find out if that's enough, or, you know.
All right, yeah, I'll look into that.
Yeah.
And all right, so we'll push that to the next meeting.
Yeah, just so we have the correct We'll
Yep.
table that one.
We make sure it's enough.
Yeah. To go back to another meeting and say we didn't have enough.
We received a communication from a resident in town that was sent to the town administrator asking that we ban the land application of biosolids and the sale of compost that contains septage. So sewer treatment plants like the MWRA that make pellets and other things, that was being sold and being used for land application. But there was a problem that it contains PFAS. So I think it's something worth looking into, but once again, I'm waiting to hear from town council about a moratorium on that.
Okay.
So I'm gonna ask you to table that.
So we have to vote on that one as well?
Yes.
So we skipped over 5, tabling that one.
Well, we didn't table it, we just said that I'd come back with a
Oh, all
number.
right.
Yeah,
Okay, my bad.
yeah.
Myself. All right, so we have to vote on number 6.
I had
Table it?
I had a discussion with town council about moratoriums,
Yeah?
and he's out of pocket. He had a health issue and hasn't been able to get back. So I expect in the next couple of weeks, we'll get that information and we can bring that back up again in August. Yeah.
Okay.
So if you'd vote to table that.
It doesn't require a vote.
No?
Okay.
Okay.
Moving on.
Item 7, same thing, I'm going to ask you to table item 7. Another moratorium. We don't have the opinion on the effect of the moratorium and whether that would expose the town to litigation. So I'm going to ask you to table item 7.
Okay.
And then item 8 is a discussion to increase the Board of Health to a 5-member board at fall town meeting. 3-member boards historically have a problem with quorums. And we have a particular problem that if we issue a cease and desist order, or we close somebody down, like in the case of Subway or another business in town, they have the right under the law to a hearing within 3 days. And not everybody can always meet on 3 days' notice when you have a 3-member board. But having a 5-member board makes it much easier to have a quorum. It's easier to do business, you get more opinions, more input, and the town administrator had sent out an email saying that this could be done at town meeting. So I would ask that the board, how you feel about having a 5-member board, and if you feel good about having a 5-member board, that the board vote to have a warrant article for the fall town meeting to increase the size of the Board of Health to 5 elected members. So how do you folks
I've been
feel
on this
about?
board for going on 9 years, and it's always been 3, and it's always been difficult. You know, just
It
for
is.
that purpose, that we generally get the agenda night of, and we can't have a discussion because it breaks the open meeting law if 2 of us talk. We each individually could speak with you, but it's still,
Correct.
so I'm all for it.
If you had a 5-member board,
Yep.
you could call Monica and talk to Monica. Monica could talk to Heather. Heather could talk individually. You could talk 2 at a time, and it would be much easier. Everybody would be much more informed. And you'd have input from 2 people with 2 other opinions, or they could it'd just be better. It would be better. So do you folks want to vote to
Yeah.
bring that to town meeting? Somebody needs to
Who
make a
wants
motion.
to make a motion? I'll entertain that, either one of you.
I'll make a motion
Okay.
to bring it to the town meeting, to increase the board to a 5-member board.
I have a motion, do I have a second?
Second.
All right, all in favor?
Aye.
Passes. All right, number 9.
Maven. So, as you know, I have taken on the responsibility of the Maven reporting. I finished my training and have been certified in Maven. I just did one of my first online classes with the Maven folks. I have 2 monthly meetings for Maven, and this is the infectious disease reporting portal. It could be a lot of work if something happens in town. If COVID kicks up, or we
But
have
it's
a big
not.
flu, or.
No. It's not gonna happen
I'm
like it
gonna tell you-
happened.
Well, I'll tell you the
3
June
years
results,
ago.
I'll tell you the June results for COVID in a minute. Because this is so confidential, this can't be done in the office.
Right.
And we have set up a computer remotely so that I can do the Maven stuff at home. I can't leave any paperwork on my desk. I share an office with the building inspector. He can't see it. So we're in charge of the Maven stuff without the intermunicipal agreement. That wasn't working out. We were getting reports from them once a year on Maven, and now we're getting them monthly. So for the month of June, they gave us a report, and we had 2 cases of babesiosis. Is that correct? I got that one right?
Yeah.
4 cases of Lyme disease, 4 cases of COVID, and 2 tuberculosis cases in town. That's the June report. Now, a lot of people aren't testing for COVID, so there's definitely more COVID going around than the 4 that got reported, but they went to the hospital to get tested, and the hospital put it into Maven. On my last Tuesday meeting with Maven, because we had a very warm winter, they're expecting EEE to be a big deal this summer. And there have been some EEE cases reported on the South Coast already on Maven. And believe it or not, dengue fever is coming into Massachusetts as well. There's been a couple of cases of that south, and they don't know how far north that's going to come into Massachusetts, but it is on their radar screen. That's all I have on Maven.
Excellent. Still 4 cases of COVID's not a lot.
Reported cases.
I was getting 60 a day,
Yeah,
so I understand.
yeah.
All right, let's move on to number 10.
Public health nurse funding. So part of the Maven thing is we're supposed to have a public health nurse
Yep.
that follows up on some of these reports and contacts the people that report. I do the contact tracing and find out if they got sick at work, did they get sick at a neighbor's party, who were they in contact with, do they live in other towns? I have to notify the other town if there was a contact and all of those things. But according to the regulations and according to Brianna from the intermunicipal regional, we were supposed to have a public health nurse. We were under the impression that when we got into the regional setup, that they were providing the public health nurse.
Right.
But when you spoke up and asked for the reports more than once a year, she reminded us that we didn't have a public health nurse. That's going to require some funding.
Okay.
Where I came from, the last town, we had a $13,000 budget, and we had a contract with a group of public nurses that traveled and went and saw people at their houses and followed up on things. So we'll have to talk about that for the next budget.
Okay. So that's ongoing.
That's ongoing.
Okay.
Number 11 is the Public Health Excellent Representative. That's part of the Maven process, but we have to designate a contact person for the reporting and participation in the Public Health Excellence meetings. And it has to be done by July 29th. You had done it in the past when you were the town nurse.
Yeah. You.
What's that?
I nominate you.
Yeah, no, I'm doing the Maven reporting anyway, so it might as well be me. And I'm willing to do it, but you have to make that nomination if you want to do it.
What do you think? You guys want to nominate Pat?
Sure.
All right, so I'll entertain a motion to nominate Pat Hannon. Who's going to do it? It has to be one of you guys. Go ahead, Heather.
And are we doing the nomination or are we
Yep.
doing that? Oh.
Nominate Pat
I
Hannon, number
nominate
12.
Pat Hannon
You have to speak up,
be the-
though.
I nominate Pat Hannon to be the Public Health Excellence Representative.
Yep. I have a motion. Do I have a second?
Second.
All right, all in favor?
Aye.
Aye. Congratulations.
Oh, boy.
All right, number 12.
We have to table that. We got word from the town administrator that that's not possible. Amanda's part of a different funding mechanism, but he has said that he will bring that up at the October fall town
Yep.
meeting, and that may be rectified. And then we come to number 13, which is a board member accepting an employment opportunity in New Mexico and would like to participate remotely. And if you want to address that, Monica, or?
I do. The way this ended up on the agenda was somewhat unsatisfactory to me, considering the fact that I now have a knee injury and I am most likely going nowhere. So I will spare the statement that I was going to read and just say that this is not applicable anymore.
Okay. So you're staying? You're staying?
Do I have to tell you about my doctor's appointments?
No, I'm just saying you're,
I'm here until my knee is better.
okay,
Excellent. All right.
that's good news. Agent updates. Nuisance conditions, solid waste and junk dealers. So I receive nuisance complaints from the selectmen and from the public, and sometimes from the building inspector. And every time I go out to a nuisance complaint, and this has happened to us several times now, if the nuisance complaint is appealed, we have to have a meeting within 3 days for the appeal. And that's problematic, because not everybody can make a meeting on 3 days' notice. I know that Heather works a midnight shift as a nurse, so not convenient. We set our schedule for our monthly meetings for the whole year, so everybody knows what the dates are of the meetings and when the agendas are due and all of that. So I found out that the town of Dudley enacted non-criminal disposition for code violations and other things in town. And what it is it's basically a ticket. And the town has used them. I was told it was a pain in the neck, but I think it's less of a pain in the neck to do this rather than have to have emergency meetings with 3 days' notice that members can't make. So we have one of these going on right now on Mason Road Extension. I've issued 2 cease and desist orders. They're doing nothing. A selectman sent an email again today saying, I need an update, the neighbors are still complaining. So I am gonna switch to this, and what this is I have to fill out the violation, the Mass General Law that applies to it, and what the penalty is under Mass General Law. And some of them are $10, some of them are $25, some are $300. But the kicker here is 1 copy goes to the police department, 1 copy gets filed with the clerk of courts, and you will receive a summons to go to court. And you have to appear, or there'll be a warrant for your arrest for not showing up. And most of them get dismissed because the people don't enjoy going to court for the day or for 2 or 3 hours. But it alleviates the problem while we have this 3-member board, that we don't have to have emergency meetings and have, maybe not even have a quorum or have 2 people voting on something. So I am making this change just to let you know.
That's in the interim until we become a 5-member board?
This is in the interim. We'll see how it works. I think this will be much more effective than dropping off a 4-page cease and desist order, quoting 5 different laws and saying you have the right to appeal within 3 days.
Yep.
Even if it's only a $10 fine, it's the inconvenience of having to go to the courthouse will make you not leave 5 mattresses on your front lawn for 6 months.
Okay.
So I just wanted to alert the board to that. Rubbish haulers, leaving trash at the curb due to non-payment. A lot of my nuisance complaints are people that haven't paid their rubbish bill. They leave their trash at the curb for 2 weeks, 3 weeks. Raccoons tip their barrels over, trash gets dragged around, and some of the people just keep piling their trash up next to the barrels that didn't get emptied. So I had had enough of it recently, and I called Pratt, who was the rubbish hauler that's licensed in town, for most of the town. They're probably our biggest hauler in town. And they told me that the people hadn't paid. And I said, I really don't care that the people haven't paid. You elected to do business with them, and I want you to come pick up the trash. And if you're not getting paid, take the trash barrels with you, and they can find a new place to get rubbish service. And they debated that, and I said, well, it shouldn't be the town's problem, and it shouldn't be the residents' problem to have trash and raccoons and other things going on because someone didn't pay their rubbish bill. So I'm gonna be recommending that when we do the license renewals for December, that we add a requirement to the licensing form that no matter what, if you elect to take on that customer, you are picking up the trash. And if you want to drop that customer, pick up the trash and take your barrels with you, and they can find a new rubbish hauler, because it's a big problem all over town. It really is, and it looks like hell. It's not good. And then the next item on the updates is housing complaints and the letters to inspect. So I started sending out my first letters to inspect of previous violators, and we're getting nowhere. But the harassment has started because of the letters to inspect. And I'll hand this down. I got this from a lady who's been trying to have her house inspected probably for 4 months now. And the landlord refuses to inspect the house. He lives in Waltham. He's not around here. He wouldn't answer my calls. I think he actually blocked my calls so that I can't call him on his cell phone. And this family's lease is expiring at the end of July. They're due to get a new lease, but instead they got a letter, and I'd like to read you the letter. And this fellow has now hired a property management company, so he's taking himself out of the mix. And they've informed the tenant that she now has to deal with them, not the landlord, and that she has to download their resident center app to pay her rent, and that they're going to charge a 2.99% fee if she doesn't do an ACH withdrawal from her bank account on the first of every month. And the lady informed me, and I agree, I've been in the same boat. You don't always have the rent in the bank on the first. The rent may be due on Wednesday, but you get paid on Friday, and you send your payment in on Friday. They also added that if the rent isn't paid on the first of the month, actually, if it's received after the 30th, they didn't even consider 31 days in a month, that there was a $50 surcharge for not paying your rent by the 30th. That's illegal in the housing code. They can't do that. And then any rent payment received after the first of the month will result in the eviction process being started immediately for being a day late. And this is retaliation for asking for an inspection of your house. I'm going to be contacting them tomorrow. I just got this today, and I'm going to send them a copy of the housing code, read them the Riot Act, and say, you had the time to do this, but you haven't had time to respond to the inspection request. And this lady's getting bitten by spiders. She's got ants in her house. She's got mold in her house. She's now been told that she can't put anything on her porches. If she puts a bicycle on her porch, it'll be thrown in the trash by the management company. And this has happened at another house on Brandon Road, where we sent in an inspection request, and they immediately told all of the tenants, you can't use the basement anymore. If it's not gone by tomorrow, we're throwing everything in the basement away. You can't use a porch. And actually, Monica, I took you on that inspection, and you heard what that tenant say. No one had access to that deck but her, but she's been told she can't leave her kids' bicycles on the deck, or they'll be thrown away by the landlord. She has mold in her house. All the paint was peeling on the walls coming up the stairs. Half the lights didn't work in the basement. There's no gutters on the house, so the water runs down the side of the house, is leaking into the basement, leaking into the windows, causing the mold. The front porch is detached from the front of the building and falling off the house. And instead, they got letters of everything they can't do. And again, just retaliation for asking to live in a decent house. And Monica, you saw the condition of the house. Would you want to live there?
No, but my favorite was the door in the basement.
Yeah, so you could see outside,
Yeah.
outside, yeah. And these people are paying $1,650 a month for rent. So we need to find a way to put some teeth into our housing regulation. We watered it down too much. So, that kills that. And the next thing that we need is a discussion for any issues that any members might want to have on the next agenda. If you can think of anything tonight, bring it up. If you can't, send it in before the deadline. What's the deadline for the next?
August 13th?
August 13th?
Yeah.
Yep.
Our next meeting's the
So
20th.
if you could get your request in for August 13th, that way you will get the agenda prior to the day before the meeting, and everybody will be better informed. I wasn't able to do Dropbox this week. I had a death in my family, and I've had to deal with that stuff. I've been a little bit busy. And then the next item on the agenda is any other business that may properly come before the board, not reasonably anticipated 48 hours prior to the meeting. And I don't have anything else.
Comments.
On what?
I don't know if anyone has anything they want to say.
Well, it has to be on the agenda.
Oh. So we'll add that next time, in case the public has anything they want to say. 'Cause we used to have
That's not on
public
the agenda?
comments.
Okay.
That's why I said we'll add it for the next time.
So like
'cause-
the selectmen do?
Yeah, we used to have it. I don't know how it just kind of dropped off, but that's okay.
So we should put that somewhere in the beginning of the meeting, like the selectmen do? So that if someone has some comments to make that aren't on the agenda, they could be addressed, you know, as the meeting goes on and you have time to think about it.
Okay.
Amanda, maybe you could look at where they place that in the agenda, and we could do that, because it would be good to hear from the public.
Can I circle back to next month's agenda? Do we want to do our homework regarding the health fair? Like, I would reach out.
Any ideas anybody has? Yeah?
Like, we could come back in August and be like,
Yep.
okay, this person said this,
Yes.
because we can't talk amongst each other.
No, but whatever you find out, you could let Amanda know.
Okay.
But you
Yeah.
folks can all talk to Amanda, and Amanda can talk to you folks separately. It's unfortunate, and that's why it takes 5 months to get something done. Because you get a month to hear about it, it takes a month to get ideas, it takes a month to refine the ideas. Public input comes in, it takes another month to work on the public input, and it takes forever. But if we had a 5-member board, it would be a whole different story.
Okay.
But you need to find 2 other people to want to be on the board. That's the other side. You know, volunteers are hard to find for some of these boards.
Is it volunteer, or is it
No,
assigned,
it's-
like?
No, it's a.
It's an elected position, but it's a
Elected. It's another
volunteer.
election.
You have to wait till June for the town election?
Yeah, so yes, yeah, so that would be the June election. And I imagine that somebody would be elected at the first time to a 1-year position, and maybe the other person's to a 2-year position, so that we don't have 3 people expiring in the same year and looking for three candidates. But that would be up to Laurie to figure out how to stagger that.
All right. Anything else, guys? All right.
Motion to adjourn.
I entertain a motion for somebody to adjourn, please.
Point of order, please. You said that at the end of the meeting, we could, the public could.
We
have-
just talked about that, and unfortunately, it's not on our agenda, so we can't open it up to public comments. I didn't realize that, because I was gonna entertain it.
That's not what you said earlier.
Who just said that?
You did. You said-
And I'm sorry, I made a mistake.
So we wasted
So-
an hour here, sitting here listening to you talk about other stuff that
Yeah.
we all came here because we're all concerned about Fish Road and the soil.
Well, we already
foundation.
tabled those things, so we can't talk about those anyhow. And again, it was an error for somebody to post that this was a public hearing. It was an error on our agenda. This wasn't a public hearing to begin with, and normally we would open up comments to the public, but because it wasn't already posted on our agenda to do so, we can't do that. That's what I just asked him. I'm sorry if you didn't hear me. I didn't mean to waste your time, but to begin with, this wasn't a public meeting like our housing regulations were or anything else like that. So we have the right to open it up if we want to, and I was incorrect. I'm sorry about that.
And the big thing about the soil stuff is we're waiting for an opinion
Yeah.
from town council. Under our operating procedures, the agenda is posted a week in advance. We didn't expect town council to be sick.
Yep.
That's something that's out of our control, and it'll be discussed at the next meeting.
But I do believe regulations allow us to submit whatever we wish in writing to the board.
Sure. We welcome that.
All right.
Yeah.
And who do we drop that off with, please?
You could send it to either Building 1 at wma.gov, or you could send it to me at health@wma.gov, or you could just drop it off at the building department
I'm
office.
gonna say, I'm old school, and most of that stuff I do, I type out it.
So,
We'll write it on your agenda before you leave, okay?
but
So you can have it.
Amanda's in the building department office. She's here every day. You could just drop it off there.
At the Board of Health office.
Yes.
Yep,
Yeah.
Thank you.
you're welcome. All right.
So were you interested in the PFAS stuff?
Oh, yes,
Okay.
I
Yep.
did a little research, I can't believe what this company has on its website.
All right, we're gonna,
We just need to we have to be careful about it.
I understand, but that's why I
Yeah.
would just submit what I was going to say in writing to you. You can read it at your leisure, and
Yep.
if you take it up at the August 13th, I'll try and come back.
actually, our meeting is the 20th. The 13th is the board's deadline to submit what we want on our agenda. So our next meeting is August 20th, 5:30. You're welcome.
So it needs to be in before the 13th, his request.
Yep.
Yes.
All right, I'll entertain a motion to adjourn. One of you, Heather,
I motion to adjourn this meeting.
I have a motion and a second.
Second.
All right, all in favor?
Aye.
Meeting adjourned at 6:13.